Vaginal atrophy. Important information you should know. The main content of this video includes 1. What is vaginal atrophy? 2. Causes of vaginal atrophy. 3. What are the symptoms of vaginal atrophy? 4. How to treat vaginal atrophy. Part 1. What is vaginal atrophy? Vaginal atrophy, also known as atrophic vaginitis, is a condition in which the vaginal wall becomes thin, dry, and inflamed due to low estrogen levels in the body. Vaginal atrophy often occurs in women after menopause. For many women, vaginal atrophy not only causes discomfort and pain during intercourse, but also leads to painful symptoms in the urinary tract. Therefore, doctors rarely refer to vaginal atrophy alone, but use the term urogenital syndrome of menopause to describe this condition and its accompanying symptoms. Urogenital syndrome of menopause can be treated with simple, effective methods. The decrease in estrogen levels leads to many changes in the body. However, that does not mean that women will have to live with the unpleasant symptoms caused by this syndrome. Part 2. Causes of atrophic vaginitis. Genitourinary syndrome of menopause is caused by a decrease in estrogen production. Less estrogen causes vaginal tissue to become thinner, drier, less elastic, and weaker. Some causes of decreased estrogen levels include after menopause, in the years before menopause, after surgery to remove both ovaries, after chemotherapy for cancer, after pelvic radiation therapy for cancer, side effects of hormones used to treat breast cancer, during the use of drugs that affect estrogen levels, such as birth control pills. Typically, the first years of perimenopause or a few years into perimenopause, signs of vaginal atrophy can make the patient feel uncomfortable. Although the frequency of this condition is quite common, it does not mean that all women entering menopause experience this condition. In addition, vaginal atrophy can also be caused by many factors such as smoking. Smoking affects blood circulation, resulting in the vagina and other tissues not receiving enough oxygen. Not only that, smoking also reduces the effects of natural estrogen on the body. In addition, women who smoke often experience early menopause. Sexual inactivity. Sex or masturbation increases blood flow and makes vaginal tissues more elastic. Non-vaginal birth. Researchers have shown that women who do not give birth vaginally are more likely to have vaginal atrophy than women who give birth vaginally. Part 3. What are the symptoms of vaginal atrophy? Vaginal dryness and discomfort. You can recognize vaginal atrophy through some of the following signs. Vaginal dryness. Vaginal burning. Burning sensation when urinating. Abnormal vaginal discharge. Itching sensation in the genital area. Frequent urination, feeling like you need to urinate immediately. Urinating many times a day. Loss of urinary control. Recurrent urinary tract infections. Light bleeding after sex. Decreased vaginal secretions during sexual activity. Discomfort during intercourse. The vagina becomes shorter and narrower. Part 4. How to treat vaginal atrophy. Use topical gel for vaginal atrophy. Most cases of vaginal atrophy are treated with topical treatments. In addition, depending on the condition and severity, the doctor will recommend specific treatments as follows. Vaginal moisturizer. Women can use some products to restore vaginal moisture. This method has a longer lasting effect than using vaginal lubricants. Vaginal lubricant. For mild cases, water-soluble vaginal lubricants will make intercourse easier. However, using mineral oil or inappropriate lubricants can increase the risk of infection. If the above two measures do not bring the desired effect, the doctor may prescribe topical estrogen. Vaginal estrogen has the advantage of being highly effective at lower doses and limiting systemic effects. In addition, they also relieve symptoms better than oral estrogen. local hormone replacement therapy, used topically and focused on the affected area. In addition, some cases are prescribed vaginal suppositories to provide estrogen to the vaginal area. Regular exercise is also important to help blood circulation to the genitals. Hopefully, with the information in this article, you will better understand vaginal atrophy from the causes, signs to treatment. Thank you for listening to my video content. Vaginal atrophy. Important information you should know. Please click the subscribe button and click the notification bell icon so you don't miss the latest valuable healthcare videos posted on this YouTube Live Safely channel. Sincerely, thank you. Goodbye.